If you or someone you love is affected by opioid-related substance abuse, you might be encouraged by some of the latest treatment options available. Joining us today is Department of Healthcare Services Marlise Perez, who serves as Division Chief of their Community Services Division, and she's here to discuss how medication-assisted treatment is useful along with other resources available. Welcome, Marlise.
Thank you so much for having me.
Yeah, we wanted to talk about feeling the impact of the opioid crisis. Can you talk about how the opioid epidemic has affected Americans, and what is the Department of Healthcare Services doing to combat this crisis?
Yeah, I'm sure almost all of your listeners have been hearing about the opioid epidemic that has really been just ravaging the US for several years. Unfortunately, just in the last year alone, we've had over 100,000 deaths due to opioids in the nation. And here in California, we've had over 6,000. And what's really impacting California in particular is the rise in fentanyl. A lot of those deaths were due to fentanyl related overdoses. And so we're really concerned about that impact of fentanyl here in California.
And we're trying to get our heads around what addiction really is. Can you explain it in layman's terms?
Sure. So, a substance use disorder, first of all, it is a disease. Sometimes you'll hear it called addiction, but basically, it is a brain disease. And so, an individual, some of us can have a glass of alcohol, for instance, and then we know we can stop. Others of us can't. And it really has a lot to do with brain chemistry. And so, depending on what drug an individual is using, whether that is alcohol, opioids, or some sort of methamphetamines, it's going to impact the brain differently. And what it does over time is what's known as addiction or substance use disorder, is where an individual literally cannot stop using that substance unless they have treatment.
And can you tell us about medically assisted treatment and how it is used as part of the overall treatment of opioid addiction?
Yeah, so even though substance use disorders, it is a chronic disease, it is treatable. And so today we're talking about opioids. And with opioids, it's one of the only substance use disorders that actually is treatable with some medication, also with behavioral therapy. So what the medication does, it's evidence-based, it's been proven long-standing. There's different medications that a doctor can prescribe an individual, and it really helps manage those cravings. It helps get chemical levels in the brain set, so then that person can respond to the behavioral therapies as well, like counseling and other methods as well.
And we have to ask, is taking medication substituting one drug for another?
Unfortunately, that is a huge myth. It is part of stigma. What's really hard for an individual with a substance use disorder is they face a lot of shame. There's a lot of just wrong information out there that, oh, the person they want to use, they could just stop at any time, and that is not true. And so, as I mentioned, having that medication assisted treatment, it isn't going to encourage the person to use more. If anything, it's really just helping them on their road to recovery. So it's really important that if you know an individual that maybe was prescribed opioids by their doctor, or maybe they are using it illegally, maybe they have gotten it off of the internet or something like that, is to talk with them and really see, what kind of help they may need, and just to be, not judgmental, but it is a disease. Get them some help.
Marlise, thank you for sharing this information today and providing resources to those in the thick of this crisis. To find out more, log on to the California Medically Assisted Treatment website at californiamat.org. YCL will be right back.